Hello all, welcome to my channel. In this video, I will be explaining what are the nutrition intervention programs to combat malnutrition in India. Let's see what are the strategies to combat community nutritional problems. Health and nutrition are the most important contributory factor for the human resource development in the country like India, the highest populated country with 1.34 billion population, has been classified by the World Bank as a country with low income, which is standing in 131 in the Rising Human Development Index out of 188 countries, the data from 2017. So with the 31.2 residents in the urban areas, 68.8 resides in the rural areas, and 6.7 are living with the below poverty line. So we will be focusing on the person who are living in the rural area is highest in India, that is 68.8. The long-term malnutrition lead to increased risk of morbidity and mortality and reduced work capacity. To combat malnutrition, Government of India implemented many national nutrition policies and many intervention programs. Coming to the basic first ever started the program of Government of India is National Nutrition Policy, which is called as NNP, started by the Department of Women and Child Development, Government of India in the year 1996. The main objective of the program is draw attention to the urgent need to reduce the malnutrition in the country and highlight the need of intersectory coordinators to achieve the nutritional goals, to identify short-term, intermediate, long-term strategies for achieving the nutritional goals through the direct policy changes or indirect institutional structural changes. So there are two type of policies are being developed under the National Nutrition Policy. They are direct interventions will be short term, and indirect policy instrument will go for the long term. This is the first nutrition program which is started is Applied Nutrition Program in the year 1963. So this was came into the force in the year 1993. So National Nutrition Policy, the direct intervention will be for short term, will be the beneficiaries will be the vulnerable groups are considered under the direct interventions, which includes Integrated Child Development Scheme, ORT, and UIP. Growth monitoring is done as a direct intervention for the preschool children. Fortification of essential foods such as iodine, iron, to address the deficiency of iodine and iron. Popularization of low-cost nutritious foods and control of micronutrient deficiencies are the some of the major interventions are carried out under the direct and short-term interventions. So as an indirect intervention, indirectly to address the malnutrition, what is needed is one need to get the food. So ensure the food security will be always a top priority of any country for the population. A per capita availability is 215 kg per person per year of the grain. So this has to be achieved. Improve dietary pattern through the production and demonstration, because the awareness should be needed in producing different types of food grains as a is required to address different sectors of the nutrition. Improvement in the purchasing power, purchasing power of the people need to be improved by the many programs called as Integrated Rural Development Program, Jawar Rozgar Yojana, etc. Public distribution system under this, which helps in attaining the food security, implementation of land reforms, wholesome infant feeding, prevention of food adulteration, nutrition surveillance, monitoring of nutrition programs, which are planned under the National Nutrition Policy, improvement of the status of women in the community or the family are the major indirect interventions of the National Nutrition Policy. If we categorize the different policies into the nutritional programs, which are maybe based on the different categories. So we have the world's unique community-based outreach program for early childhood care and development, that is uh, uh, which is ICDS, we call it as Integrated Child Development Scheme. Next category we have nutrient deficiency control programs. There are many nutrition problems in India. We have the specialized program for the control of the deficiencies. For example, vitamin A deficiency, iron deficiency, and iodine deficiency are common in India. So the programs for the nutrient deficiency control, and we have food supplementation programs. So additional food supplement in SNP is a special nutrition program. Under this, Balwadi feeding program, composite nutrition program, applied nutrition program, where children are supplemented with the food or a meal at the school or at the Anganwadi centers, Balwadi centers, etc. To ensure the good nutrition. The food security programs such as public distribution system, Anna Yojana, Annapurna scheme, and National Food for Work in order to increase the purchasing power of the person, self-employment schemes, and self-employment wages and employment scheme are the some of the broad categories of the uh, programs or the intervention programs in the India we see. So firstly, we will discuss what is ICDS, that is Integrated Child Development Scheme. This is the to address the pediatric malnutrition, means to reduce the number of malnutrition cases in India, that is in the vulnerable cases are at the preschool age, that is 1 to 3 years of age, are more vulnerable for the malnutrition. In order to reduce that, these programs are being implemented. The various vertical health programs initiated by Government of India from time to time did not reach out to the target community adequately. In 1974, India adopted a well-defined national policy for the children. The ICDS especially work for the children. In the pursuance of this policy, it was decided to start the holistic multi-centric program with the compact packages of the services. So the decision led for the formulation of integrated child development scheme, one of the most prestigious and premier National Human Resource Development Program of Government of India, which is reaching to the many children across India. The scheme was launched on 2nd October 1975 in 33 areas, where 4 rural, 18 urban, and 11 tribal blocks were initially started with ICDS. Over the last 25 years, it has expanded progressively. At present, it has how many centers? 5,614 blocks. It has the central blocks as well as in the they are distributed across the states of India. The project covering around 5,300 community development blocks and 300 urban slums, over 60 million children 60 million children below the age of 6 years and over 10 millions of women between the age of 16 to 44. That 16 to 44 is called as what? That is a reproductive age of the woman, where most of the malnutrition is seen, which has impact on the pregnancy in India at that period of time. To considering that aspect, even pregnant women are the part of the ICDS. Pregnant women at the age of reproductive ages are the part of ICDS, and 2 million lactating mothers. The population under ICDS coverage is 70 million. Total population is covered under the ICDS, which is approximately 7% of the population of 1 billion. So what are the different objectives of ICDS? As we have discussed already, it is implementation in the health and nutritional status of the children, pregnant women and lactating mother, a reduction in the incidence of their mortality. Mortality is a death rate. So in order to reduce the deaths of the children in the various stages during delivery, in the infancy, in the neonatal age, were addressed under this program. And in order to reduce the school dropouts, provision of firm foundation for proper psychological, physical, social development of the child. So in order to consider overall health of the children, enhancement of maternal education, capacity to look at her own health, nutrition of her family, because if a woman is given the awareness about the health, uh, how to take care of her health, and she will of course take the good care of the uh, children's health as well. Effective coordination of the policies and implementation of various departments programs aim to promote the overall child development. So who are the beneficiaries and the services, which I already explained? The children of 0 to 6 year, pregnant women, lactating mothers, women between the age of 16 to 44, and since 1991, adolescent girl also included under this, and which is for the non-formal education training on the health and nutrition, giving the training for the adolescent. So which are the services covered under the ICDS is complementary nutrition, vitamin A and iron, folic acid tablets are distributed free of cost, immunization, health checkups, treatment for minor elements and referral services available under the ICDS, non-formal education on health, nutrition to the women, preschool education to the children of 3 to 6 years old, covering the other supportive services like providing the good water and sanitation, etc. to the population. So next we have midday meal program, which is again the part of ICDS. Midday meal is aim of the midday meal is avoid the classroom hunger, in order to increase the number of children in the school, that is school dropout, to reduce the school dropouts, and in order to enhance the school enrollment, increase school attendance, improve socialization among the castes, address malnutrition, empower women through the employment, were the sum of the aim of the midday meal program. In September 2021, again midday meal scheme was renamed as Prime Minister Poshan, Pradhan Mantri Poshan Shakti Nirman. Under this it is again renamed as a PM Poshan. Will extend the hot cooked meals to the students studying in the pre-primary level or Bal Vikasas of government and government aided primary schools. In addition to this, already covered under the midday meal schemes, the already which are the schools which are covered under the midday meal are the part of PM Poshan. So in the midday meal, monitoring the nutrition, because to address the malnutrition, maintaining the proper height and weight of the children is very very important. That is, focusing on the growth of the children. So growth monitoring are done in the schools. Height, weight, BMI, their HB levels are monitored. Nutrition garden with the active participation of the students in order to provide the awareness to the students. Promotion of ethnic cuisine. So next set of the programs, we have nutrient deficiency program, uh, deficiency control program. That is something called as prophylaxis programs. So in India, prophylaxis programs are available for the vitamin A and iron. The National Prophylaxis Program against nutritional blindness due to vitamin A deficiency, which is NPPNB, due to VAD is vitamin A deficiency, was started in the year 1990 with the specific aim of preventing nutritional blindness due to keratomalacia. The program was launched under a remedial measure to combat unacceptably high magnitude of xerothalmic blindness in the country seen in the year 1952 to and 1960. So objective of this program is prevention of blindness due to vitamin A deficiency, educate the mothers to consume the foods rich in vitamin A during their pregnancy. Under these are the objectives. What are the direct measures to combat vitamin A deficiencies? The children are given the massive doses. The first 1 lakh international units, that is IU, for the age 6 to 11 months. The second dose consisting of second 2000 lakh IU for the 1 to 5 years of the age for the children. So this is a short or the direct intervention. So long term interventions are providing awareness to the mothers to consume the foods rich in vitamin A, beta carotene during the pregnancy, encourage the mothers to feed the colostrum, that is the first milk secreted after the delivery, that should not be thrown out, that should be fed to the children, which is a very rich source of vitamin A. So next deficiency control program we have is anemia control program. Anemia is a severe public health problem among all vulnerable age groups in India. It presently the National Nutritional Anemia Prophylaxis Program was initiated very early in the year 1970, was raised and expanded due to include the beneficiaries from all the age groups, namely children aged between 6 to 59 were the part of this program, 6 to 59 months. After that, 5 to 10 years, adolescent, pregnant women, lactating mothers, women in the reproductive ages are the part of or the beneficiaries, you can say, of the National Iron Plus Initiative Program, which is again renamed in the year 2011. So access to the baseline prevalence of nutritional anemia in the mother and young children through the estimated hemoglobin. How we will identify their whether they are anemic or not? By doing the estimation of the hemoglobin. Give the prophylaxis treatment. Doses of iron folic acid tablet are given to the mothers and the children who are suffering from the anemia. Monitor the quality of the tablet distribution, consumption of iron and folic acid supplements continuously, so that monitoring of the supplements and quality monitoring is also the part of a nutritional anemia control program. Motivate the mothers or the pregnant women to consume more iron rich foods. and ensure the vitamin C should be present with iron, because vitamin C helps in the absorption of iron. So primary health centers, sub-centers, paramedical staff responsible for the distribution of these tablets under the ICDS assists under the ICDS program, and ICDS also assist in this effective implementation of National Nutritional Anemia Control Program. Next, we have National Iodine Deficiency Disorder Control Program. This program was introduced by the Director General of Health Service for the endemic goiter in the year 1962, mainly Himalayan and sub-Himalayan belt in India. Means only that areas were more prevalent of were getting the iodine deficiency. The main objective is to identify the goiter endemic regions, means in which parts of the India where goiter is endemic. That has to identifying that was aim or the objective of the program, to provide iodized salt to the affected areas to access the program over the period of time. In India, there are 16 million people are at risk of developing this iodine deficiency. 54 million have goiter, 2.2 million have the cretinism, and 6.6 have mild neurological disorders. In order to reduce all this, so the program has been initiated. Program components including distribution of iodized salt, the oil which is distributed with the fortified with the iodine, iodine monitoring and surveillance, manpower training, and mass communication. Through mass communication, awareness is given to the public to consume more of the iodine rich foods and include iodized salt as a part of the daily article. Then we have the next set of the category of the program, that is supplementary feeding program. National program of nutrition support to the primary education, that is again as a one of the important program of covered under the ICDS, which is midday meal, providing a meal to the children at school. Special nutrition program, Balwadi feeding program, composite nutrition program, and applied nutrition program. Under all of these programs, the food or the supplementation of the supplementary feeding is given at the school premises or the Anganwadi areas, Balwadi centers, where children have the access to consume food. Special nutrition program was launched in the year 1970 to 71, providing the supplementary nutrition to the pregnant woman, lactating mother, and the children of preschool age. So Balwadi feeding program was started in the year again 1970s to 71. Children of the Balwadis were given the food there. Composite nutrition program started by the Department of Community Development. Nutrition education through the Mahila Mandalas were under the composite nutrition program. They were also into the providing education to the mothers through the Mahila Mandalas, where group of women um, mix and discuss the issues, where education is given through such mandalas, and encourage economic activities of the mandalas, giving training to the women uh, for the preparation of the supplementary feeding, demonstration and awareness for the recipes are prepared in a healthy way. Demonstration of the feeding are the some of the activities which are covered under these programs. Then we have the food security program. The food security refers to the access to the food, access by all the people at all the time for the enough food for the active and healthy life. Food is again the basic right, one need to consume it. How the for food security program, can be accessed under the increasing purchasing power, supplying the food grains at the subsidized prices. Government uh, supply some of the staple grains at the subsidized rate. Under the public distribution system, important constituent of the strategy for poverty elevation. In order to reduce poverty, this is a very important component to reduce the poverty and major instrument of government's economic policy for ensuring food security in the country. We have Poshan Abhiyan. Poshan Abhiyan, also known as National Nutrition Mission, was launched in the year 2018 through the program being implemented in the year 2017 by Government of India to aim to tackle the malnutrition problem prevalent in India. Under this, the chief objective of the mission is to reduce the levels of undernutrition, also enhance the nutritional status of the children in the country. The mission is the multi-ministerial initiative and aim of removing malnutrition in the country by the year 2022. So when it was started, the aim was to remove the malnutrition from the country up, by 2022, and Poshan Abhiyan in India is a flagship scheme to improve the nutritional outcomes of the adolescent children, pregnant women and lactating mothers. The term Poshan is the name of the program that stands for Prime Minister Outreach Scheme for the Holistic Nutrition. The program was specific target to reduce stunting, anemia, undernutrition and low birth weight in the which was more commonly seen in the children. Children are born with the less of birth weight. So to address the pregnancy, in order to improve the growth standards in the country, to eliminate the anemia and to reduce the undernutrition, which are the main factors for the malnutrition in the country. According to the mission, by the year 2000, mission 25, the National Nutrition Mission aimed to achieve the reduction in the stunting from 38 to 25% by the year 2022. So one of the major objective of Poshan Abhiyan is to leverage the technology for monitoring, improving services delivery for the beneficiaries, including uh, preschoolers, pregnant women and lactating mothers. In this direction, what the latest technologies they are using under the Poshan Abhiyan is Poshan Traker application. So this through this Poshan Traker application on the live, this one on the daily basis, the government can access the data. In this direction, a robust ICT enabled platform Poshan Tracker was developed by the Ministry of Women and Child Development and launched on 13th January 2021. This was done to ensure the real-time monitoring of providing supplementary nutrition and real-time information for prompt supervision management of the services. Further, the first time Anganwadi workers have been provided with 11.75 lakhs of smartphone. Besides, besides this, to promote the regular growth monitoring, 12.36 lakh of growth monitoring devices like infantometer, stadiometer, weighing scales for the infants and weighing scale for the mothers, children's have been procured by states and under different union territories under this Abhiyan. This was the latest where they can get the real-time access to the data of how the Poshan Abhiyan is working on the day-to-day basis. And we also celebrate Rashtriya Poshan Ma under the program. Rashtriya Poshan Ma celebrated in the year throughout the year of September. earlier, the September month from 1st to 7th, it was observed as the National Nutrition Week. So now the Prime Minister has declared the Poshan, the September month will be the Poshan Ma and celebrated by 2018 onwards. The Poshan Ma will focus on the social behavioral changes, communication in the broad theme where the antenatal care, optimal breastfeeding, complementary feeding, anemia, growth monitoring are some of the objectives of the Poshan Abhiyan. Rashtriya Poshan Ma is celebrated each year in the September to aim to cover awareness about nutrition and healthy foods. Ministry of Women and Child Development celebrating 5th Rashtriya Poshan Ma in the year 2022 across the nation from 1st to September with the different objectives. Mahila और स्वास्थ्य, बच्चा और शिक्षा was the theme in the year 2022. Poshan Pakwada was also celebrated under this program where more of importance is given to the local grown crops, and in order to promote the good nutrition habits and promote the healthy eating habits through the Jan Andolana and Jan Bhagyadari. Every year Poshan Pakwada is celebrated in the year March, similarly in the September. So under this, closely around 2.96 crore actively participated under the Poshan Pakwada in the year 2022. So Poshan Pakwada for 2023 aim was nutrition for all together towards the healthy India, where lot of importance is given to the local grains, which they have named as, it is also declared as the International Year of Millets, uh, to give the importance to local produce, which are called as the Shri Anna, the mother of all grains, are valued asset to address the malnutrition. Under the Poshan Pakwada's lot of activities they carry in order to bring in awareness about the nutrition, promotion and popularization of Shri Anna, where people have to get lot of awareness about the millets, including local produce, local millets for the reduction of malnutrition. Celebrate of the Swasthya Bhalika Spardha were celebrated, where children's are participated under this program. Popularize section Anganwadis, where the activities which are conducted under the Poshan Pakwada. Anaemia Mukta Bharat, we have already discussed the Anaemia Control Prophylaxis Programme. Still we have lot of anemia cases on the today's basis. So again, National Health Missions and Anaemia Mukta Bharat together, they have came under some intervention of prophylactic iron and folic acid supplement and with that deworming tablets, intensified year-around behavior change communication campaign, where with the solid body smart mind, including ensuring delayed cord clamping in the newborn, testing for anemia, mandatory provision of iron and folic acid fortified, which are distributed as free of cost in all the public health centers, addressing non-nutritional cause of anemia were very important interventions under Anemia Mukt Bharat. The children, you can see the percentage, which is the data from 2019 to 21, with the child of 6 to 59 months having 67% of anemia cases in India, where uh, women at the reproductive age is around 57% of the women still have the show anemia cases. So with this, we have discussed all sets of the intervention programs. So I would conclude by ensuring food security, promoting healthy eating habits, effective implementation of nutrition intervention program may help to combat malnutrition. In urban population, we can see the imbalance of the nutrients and micronutrient deficiency, which are increasing the level of non-communicable diseases as well. For healthy life, modification in the lifestyle is a need of an hour. With this, I will be ending the today's session. In the next, I will be taking on a lot of the problems of nutrition problems in the country. Will be my next upload. Thank you.